Hello, and welcome to the third episode of the ThinkingCAAP. This is Amanda Hopridge, Chief Operating Officer at Community Action Association of Pennsylvania, and I'm joined with my co-host.
Hello there, Beck Moore, CEO of the association. And also with us today, we're so excited to have our next guest on our third episode. If you want to introduce yourself, my friend at the National Community Action Partnership and CEO.
Thank you so much, Beck and Amanda, for having me today. Denise Harlow, CEO of the National Community Action Partnership. We're the hub for the nation's 1,000 local agencies. We are the CAP of DC, I guess. So glad to be here.
Love that comparison, Denise. And thank you so much again.
Yeah, happy to
So,
be here.
we're really here talking about a big milestone for community action, which is our 60 years of community action celebrating all year. And I know, Denise, you're coming off a very successful convention this year with the 60th anniversary.
Boy, are we. We had 1,800 community action leaders, volunteers, board members, staff, customers from all over the country in Seattle, just really commemorating this important anniversary and learning and gleaning so much great information from each other. It was a great week.
So, Denise, coming off that conference, we're going to kind of jump into our conversation today. And our favorite question is, what myths are you busting about community action?
Wow. What a great question. I think there are so many myths about community action and human services in general, but community action is a network of organizations that have been in existence since 1964. We are innovative. We are outcome focused. We are high impact. We have agencies on the cusp of the best thinking about what's going on in terms of fighting poverty across America. Our agencies are using evidence-informed strategies. They're creating the evidence of what's working in community. And our agencies are able to take governmental dollars, private dollars, in-kind contributions, and truly provide just these changes in communities, these impact for families. And sometimes people think that we're doing individualized services. Do we do some of that? Yes, but it's the high impact, it's the culmination of all of this work and centering the family. Our agencies are just doing such high impact work in every corner of America and especially across every corner of Pennsylvania.
Yeah, I love that description for sure. And one of the ways that I like to describe community action across the country is that we're one of only 15 nationally networked human services providers. There's not that many of us that have this larger national network, and it's one of, I think, the great benefits of being able to work alongside other organizations, other associations. We learn from each other. We learn from the great things that we're doing, and we learn from the things that maybe we've misstepped on a little bit, right? So I think, one of the things that I would love for you to talk a little bit about that we try to help people really understand is the long-term structural impact that our organizations can have on a family. Not a lot of people understand that this isn't just, right, somebody walks through the door and then they walk out. Our agencies are really spending a lot of time oftentimes with families to help them have longer term success. So if you could talk a little bit about that, that would be awesome.
Yeah, community action is the expert, right? And there's so much of the foundational research world that talks about centering on family. Well, community action has been doing that for decades because it is about having a family come in the door and figuring out what do they determine is going to need to be success for them? What do they need? Not what do I have to just give them. It's about ensuring that the family, the individual even gets to determine for themselves what services and programs do they need and what do they actually want to achieve. And in community action, we talk about the whole family approach. Now, that builds on 2Gen, right? Many of us know about 2Gen, but in families living with low income and who may be struggling, we see so many generations in a household, not even always related necessarily to one another. So we really look at it as a comprehensive whole family, whether it's early care, prenatal WIC assistance to a pregnant mom, to seniors needing Meals on Wheels and congregate meal support or social interaction or even assisted living in some communities. But along the way, what are the services they need? What are the supports? What's the coaching that might be beneficial to help a family meet that success? And it's figuring out what is that right bundle of services, but also what is that human support. We talk about the promise of community action. We talk about embodies the spirit of hope. And so many folks say that the community action difference is that spirit of hope, that when a family comes into a CAP agency, they really feel like they're being seen. that they're being responded to as an individual group or an individual person, not a cookie cutter approach. Hey, we have this service if you want it or not. No, it's what do you need? And our whole family approach frame, I think, pushes the boundaries on funding silos and data silos and regulatory silos. When we push back against those powers that be and say, you want to help a family succeed and achieve their ultimate success, you have to let these flexibilities happen. And we are experts at figuring out how we do that to help the family.
Well, and I think to that end, one of the great things about the funding that our agencies receive across the country, right, community services block grant
Oh,
money,
yes.
is the opportunity to use that money as a really flexible spending to address some of those really specific needs sometimes that occur in a family that mean big issues, right? So say somebody's transmission goes out in their car. Is there funding, right, in a local community to necessarily pay for that? Is there a car program? Maybe there is, maybe there's not, but that change for someone to have regular, reliable transportation means life or death in some instances, right? Or putting food on a table. And so the great thing is that those types of solutions with community services block grant money can be realized, right, through some of that.
Yeah, CSBG, the Community Services Block Grant, really is that capital that an agency can use to meet an individual family's needs. And poverty for a family might look different in Philadelphia than it will in Pittsburgh or Scranton or a rural part of Pennsylvania, right in the mountains, right? It's going to look different. And CSBG gives a local agency flex for the local family. But the other high impact value of CSBG, you can use it for macro planning. You can use it for strategizing. You can use it for community level change to try out things. It's kind of that laboratory concept of knowing what works and creating the evidence. CSBG is that capital that community action agencies have, and that is just precious dollars across this network that we really put to really good use.
Yeah, absolutely. And one of the ways that I've been describing our work more recently, particularly with respect to healthcare, is and trying to advocate in that space is helping people understand that community action agencies in particular, and really the larger network of community-based organizations are really specialists, right? And so it's important for folks to understand that just like we get referred to a gastroenterologist or a cardiac specialist, that type of specialized understanding of somebody's the resources that they need and some of the things you've already spoken to, we need to be looked at in that same vein. And that comes at an expense, right? Those localized solutions can be somewhat expensive. Sometimes they can be pretty simple. But when we can work alongside our healthcare partners and other organizations, it's when we find a lot of really remarkable success to help people ultimately live longer, healthier, happier lives.
So true. The expertise to navigate this human services, social services system, that is not an easy system to navigate. And especially if a family is experiencing a health crisis, having a healthcare system partner with a local community action agency or a network of community action agencies can make all the difference in the world. So you're working again with that local expert who understands what's available, how do folks apply, how do we navigate these systems. It's just as complex as a hospital system, if not more so, with
Yeah.
all the eligibility factors and all the different parties and all the different funding streams. I couldn't agree with you more that community action has a significant role to play, and especially in Pennsylvania, you are a leader in partnering with healthcare payers, healthcare systems to figure out how do we help the healthcare system come to the experts
Yeah.
so that families who are in their system and our system can thrive together.
Yeah, absolutely. Thank you for recognizing that. We've spent a lot of time working with our agencies
Yes.
and them really advising us on that being, the next sort of opportunity for community action on the whole. So we've spent a lot of time talking about it as a network. It's why we had one of our prior partners on our prior podcast, Karen Van Zant.
Shout out episode
Yes.
2.
Yep,
Yes.
Catch up
absolutely. If you haven't listened to
if
it,
you
listen to
haven't
it.
listened.
Yep.
Yes.
Karen is amazing
So,
at really helping people understand some of those things. So I know Amanda wants to keep us on task.
yes,
So Amanda, I'm
I'm
going to
gonna
toss back to you.
Yes, ma'am.
I'm going to jump in because you all have absolutely described exactly my next question is that we are so adaptive in communities. Community action is hyper local, micro local solutions. And the reason we've been 60 years strong is because we're not using 16-year-old program methods, right? We are adaptive, we're changing. Can you speak a little bit, Denise, about what you're seeing on the national level of why community action is different and why we're so adaptive?
Well, CSBG helps us be adaptive for sure, but it is also a very small part of our budget. But what happens with a local community action agency being a larger, more entrepreneurial focused community action agency, I think about affordable housing, for instance. You can give out housing vouchers, you can do shelter services, and agencies do that. But we have agencies building affordable housing, multifamily units, multiple houses in a development, because we understand the affordable housing crisis is real. So we're able to leverage private dollars, lending dollars, tax credits. We're not just in a give us a grant, we'll go do something. This network is entrepreneurial focused, and housing is just such a great place alongside the social determinants of health and the healthcare space. Those two spaces really align well, where you see the entrepreneurial high impact of why community action is different. We understand it. We understand data systems. We understand accountability systems because we've had to navigate all these governmental systems for years. So we bring so many assets to the table that when someone's able to plug in with us, great things can happen.
Yeah, absolutely. I mean, the way that we like to describe it is that we've been addressing social determinants of health before it was called social determinants of health.
Yes.
We've been addressing human-related social needs, right, before it was ever called human-related social needs in really complex ways. Part of what our work has been trying to help to start to translate that work, over into healthcare because we don't speak the same language as always. So it's what we've been really trying to speak to. And I think with respect to the affordable housing and the some of the work happening in Pennsylvania, I think at last count, if I'm not mistaken, 22 to 27 of our agencies have currently are operating or owning affordable housing units in some capacity. Some may have one, and then others have far more than that. And so it's a pretty one of the largest focuses, I think, for the majority of our agencies here. And housing has been a really important topic across the country, no different here in Pennsylvania. I know that many of our team members and some of our agencies have been sitting on some of the steering committees here in Pennsylvania and some of the task forces with our administration, and talking about this very topic and trying to find, more innovative solutions than what have already been created. I think one of the things I wanted to make sure to touch on before we wrap up today is going back to something that you said before about some of the outcomes. And a lot of times when we're asked to talk about our work, we get a little mixed up in talking about a specific program, right? And really kind of getting really detailed about that particular program. But from my perspective, it's not so much about the program, right? It's about the outcomes versus outputs. And not everybody understands that language. So could you talk a little bit about that for us?
Sure. And people say we need to focus more on outcomes. Well, community action, we've been on outcomes for decades. We understand this process. We understand the importance of a utility payment. Might be cash in hand to pay a late utility bill. The outcome is that family for the month of January in winter in Pennsylvania, that house is heated, right? The fridge is on. That the kids in that household have a better chance of learning, of staying healthy. The asthmatic may stay out of the emergency room. The grandparents aren't going to experience perhaps the same health crises, right? It's those outcomes. Utility payments an outcome, right? We want people not to be in debt to the utility company, but the outcome is important. Yes, we want Head Start as a program to be beneficial. Yes, you want a button seat, right? To use a technical term in Head Start. And getting a kid ready for kindergarten, critically important. But the outcome for the family, the parents or the caregivers are empowered to better advocate for their children as they progress through the education system. That learning takes care with the child beyond being ready for kindergarten. The health care that child provides, the child's going to be healthier as well, in addition to having a slot in a Head Start program. All those things is that we understand the programs are critical. We have to count the outputs, but we want to be focused on the outcomes. And
Absolutely.
sometimes it's the blending of the WIC and the early Head Start and the housing voucher and the importance of LIHEAP in a house. All that stuff helps make a family succeed.
Yeah, absolutely. Well said. I appreciate that example, the description so much. I think it really helps to crystallize for people some of the complexities of the work. And ultimately, right, I think part of what I also want to make sure to just say again, and I know we've probably said this on prior episodes, but I think the other great part about community action that I really love is also looking through community needs assessments and through partnerships in local communities so that there aren't duplicative programs. And so the agency doesn't have to necessarily offer that localized service themselves, but they're partnering with other CBOs, nonprofits that are also doing that work well, or offer even a more specialized, maybe culturally appropriate program for a particular population in a local county so that it helps even greater outcomes, right? In ways that they recognize they're not the experts. and working with those experts. So it's one of the other things I just love so much about our network.
Yeah, people will come to me, well, Denise, what's the one program every CAAP agency? I'm like, that's not how it works.
Right.
Not every community needs us to replicate certain programs because there's another great provider that's already doing it.
Yeah.
And we're able to use our resources to do different things. And it's the beauty and the challenge sometimes of talking about community action, but it is that needs assessment drives it hyper local. The maximum feasible participation, our boards of directors are all local. Each individual community action agency is its own entity, and being statutorily required to do a community assessment, has some challenges in terms of getting a product done, but the impact of that product is real and meaningful, and we wouldn't be successful for 60 years if we weren't able to drive local. And that
Oh,
raises for me, right, our
yes.
need to, and we wouldn't have been around for 60 years if we didn't appeal to the broader community. We are nonpartisan as an organization. The Community Services Block Grant, Congress is our best friend when it comes to CSBG. No matter on what side of the aisle you are on, you care about your local community, your local constituents.
Yeah.
And that's where community action shines, is that we care about local. But you added this earlier, Beck, right? It's this interconnectivity of this network that we are so lucky to have. It offers different kinds of infrastructure and supports that keeps this network functioning in a way that families deserve. Families
Absolutely.
deserve an
Absolutely.
infrastructure. Just like we have a network of fire departments, we need community action to be responsive to community and individual needs.
And our board chair says this so much more beautifully than I ever will. And it's in our video that's on our homepage, which you can find at THECAAP. Thank you, Amanda. Go ahead.
www.CAAP2As.org.
But she says, right, everybody deserves to dream.
Mm-hmm.
Everybody.
And community action helps people to realize those dreams. And it's a
All right.
beautiful network.
I'm going to put you both on the spot to close us out. So, in one phrase, talking about how we've been so adaptive in our communities and so effective for the last 60 years, one phrase, what's in store for the next 60 years?
Oh, Amanda.
Yeah.
I hate when you don't tell me the questions ahead of time. Oh.
Community action will continue to evolve to meet the needs of families and communities. And I hope that in 60 years, right, we are not necessary to fight poverty. I hope that our country and our systems are built in a way that families have every opportunity to succeed, no matter where you live in America. Everybody has the chance to succeed. And community action will be there hand in hand with families and communities.
Yeah, I mean, well said. I don't know that if I can top that. Right before here's what I will say. Okay. I'm going to probably not answer your question, but we'll answer your question. Right before I jumped on this, I was scrolling on LinkedIn, just trying to kind of catch up with some things. And I saw this post from our Philadelphia organization. And there was a post about the fact that poverty is the lowest that it's been in, I think, 4 decades in Philadelphia. Still one of the poorest cities in the country. But the fact that we've actually seen a change in that poverty number is pretty remarkable. And so while I look at the fact that over the course of the last year, community action across Pennsylvania has served 503,000 people, and when you have just over 12 million, 1.4 of those living in poverty, it's a pretty remarkable accomplishment to see how many people we're serving. And that's more than what we served last year. And I think to Denise's point in her response to you, Amanda, that while we continue to see that number go up, we know that the long-term impact is uncomparable, right, across other human-related social needs providers, and that ultimately we know that we want to put ourselves out of business, right, to just continue to help people. And I hope that is a true reality in the future, because the intentionality of how community action was created creates the opportunity to do that.
Well, that is the most incredible way to sign off our 3rd episode. Thank you so much, Denise, for your time today and joining us. And thank you to all of our listeners. I can't believe we have so many supporters out there already. If you have not listened to the first 2 episodes of the ThinkingCAAP, find us on YouTube, Spotify, and Apple Podcasts.
Thank you again, Denise. Appreciated having you. And thanks, everybody, for listening. We'll talk to you again soon.
Thanks, everybody.
Thank you for being a part of this episode of the ThinkingCAAP. Check the show notes for resources and links to other episodes. And don't forget to subscribe and follow to be notified when new episodes are released. If you have any community action questions you'd like Beck, Amanda, or one of our local experts to answer in a future episode, please email your questions about community action to info@thecaap.org. Subject line, ThinkingCAAP.